Hi, my name is Aaron Beleza, and I decided to do my storyboard project on wait times at Student Health. The team members include myself. I decided to work on this project solo. My mission and vision. My mission is to provide better patient care by cutting down wait times while providing top-notch patient quality care at the WVU Student Health Center. My vision is to provide patients with services in a timely manner with wait times not exceeding 30 minutes. Customers and requirements. For the customers, that includes students/patients at WVU Student Health Center, along with employees and medical staff. The requirements include having a clean waiting room, providing timely care, accurate care, and of course being respectful, having respectful staff and medical employees. Within the middle box are three graphs that were taken from my survey. Graph 1 is the graph showing the reasons for visiting WVU Student Health Center, and I surveyed a total of 23 individuals. 65.2% of the individuals I surveyed were there at Student Health for a sick/non-sick visit, while 17.4% of the individuals I surveyed were there for vaccines. Graph 2 is comparing if the people surveyed were a walk-in or had an appointment. And 82.6% were a walk-in, while 17.4% had an appointment. Lastly, graph 3 is comparing if the individuals surveyed waited in the waiting room for over 30 minutes at the Student Health Center. 52.2% said yes, while 47.8% said no. Lastly, for recommendations in the last box, the foremost recommendations I comprised based off of the feedback I received on my survey were more rooms, more staff, which I feel like since it is a big campus, those are needed, especially since the people visiting student health aren't just students. They are also residents within Morgantown. And the last two is listening to your patients. I saw through my survey that there were a couple instances where the staff and employees just didn't listen to their patients. They were kind of rude, kind of seemed like they were in a rush, and that's just something that shouldn't be happening at the student health center, especially in any healthcare facility, in that fact. And lastly is improving communication with patients. Another big thing I saw was that the staff and other medical employees wouldn't have the greatest weren't the greatest when it came to telling patients that they were allowed to leave the room. Some patients ended up staying 10 minutes, another patient ended up staying over an hour, and that poses a big problem because that is part of the reason why the wait times are so long, is because rooms aren't available, and that room's being taken up by someone who already received the care that they needed. They were already set to go, they were just not informed. And another big thing is that staff would often get irritated that the patient left without them telling them to go, even though their care was already there, it was already done. So those are the four biggest recommendations I could pull within my survey that I could come up with. And obviously from the 23 individuals I surveyed, those were their biggest concerns as well. But that concludes my project. Thank you.